And what we found was actually very interesting. What we found was that after just a single bout of 20 minutes of exercise on the treadmill, children with ADHD, they can better detect and process distractors from the environment. And these benefits can sustain for about 1 hour after they stop the exercise.
Welcome to All Aboard, where we help parents navigate the ADHD journey. Whether you're at the beginning of this journey asking what now, or you've trodden this path for a while and are wondering what's next, All Aboard ADHD is here for you. We will bring you key information from expert interviews alongside parents sharing their real-life lived experience to help you feel less alone. I'm Claire, and today we'll be talking about ADHD and exercise with our expert guest, Dr Stone Hsieh. Stone is a senior lecturer in the Department of Psychology at Kingston University. He has a PhD in exercise psychopsychology from the National Taiwan Normal University and has worked with Professor Charles Hillman as a postdoctoral researcher at Northeastern University in the US before coming to London in 2021. Stone's ActiGamer research focuses on the effects of exercise on cognition and ADHD symptoms in school-aged children. Welcome aboard, Stone.
Hello, Claire. Thank you for having me.
Thank you for joining us today. So I'm super excited to talk to you about exercise because it's something I'm really passionate about when it comes to managing ADHD symptoms. Both of my kids have got ADHD, and from a young age, I've kind of done everything in my power to channel that endless energy into exercise. In fact, when my son was really young, when he was like a toddler and preschooler before school, I used to joke that taking him to the park was just merely a warm-up. Like it might tire out other kids, but it was never going to tire out mine. And they're both immensely sporty, and I'm never quite sure whether that's a byproduct of being exposed to all of this activity because it was necessary to kind of help them find their thing, or whether it's a predisposition actually from having ADHD. But either way, I can say from personal experience as their mum, and also for myself as someone who has ADHD, that exercise has a significantly positive effect, I think, on symptoms and mood and self-esteem. So what do we know about the effects of exercise on ADHD?
Yeah, so basically so far, we know that exercise, especially exercise at a moderate intensity. So that means the intensity where you can chat or talk with your friends, with your parents while you are doing the exercise. And what we found from research is that this intensity of exercise can potentially lead to improved cognition, improved attention, and improvements in multitasking and mental health, such as it can reduce anxiety, stress, and depressive symptoms. More specific for ADHD, I think this intensity of exercise is also effective to reduce their core symptoms, or we call behavior symptoms, such as inattention, such as aggression or impulsivity. And beyond this, there are also research showing that exercise at a moderate intensity can also be very helpful for conditions related to ADHD, such as sleep. Many children with ADHD, they have problems in high sleep quality. And also, this exercise is also beneficial for the management of our appetite. So I would say that the effect is quite comprehensive for regardless of we have ADHD or not.
Yeah, absolutely. So what's happening in the brain then? Because there's obviously some significant impacts there, certainly for those that have ADHD. What's happening in the brain when we're doing that exercise, and how is it helping?
It's actually quite interesting. So basically, during or right after exercise, or maybe 1 to 2 hours after exercise, we can see increased levels of specific neurochemicals in our brain. So such as dopamine, such as serotonin or norepinephrine. But basically, these neurochemicals, they are very important or essential for the growth of our brain neurons. So with these changes, transient changes after exercise, during or after exercise, as a result, we can get better activation of different brain regions, such as, especially for brain regions that are important for attention, for multitasking, such as our prefrontal cortex. And we can also get better connectivities between different brain regions. That means our different brain regions can communicate with each other more effective and communicate better during or after exercise. So if we can repeat this exercise over and over again, eventually we will be able to focus better. We will be able to be well prepared for any incoming task. And more importantly, we will be able to get better mental state. So lower risk for, say, anxiety or stress. Yeah.
That's interesting. So when you say repeat the exercise kind of over and over again, are you talking about the same exercise so it becomes a kind of pattern that your body and brain get used to, or do you just mean the frequency with which you exercise so that the exercise itself becomes habit?
Yeah, when I say repeat over and over again, that means we get used to the exercise and we repeat the regimen. So that means we do multiple sessions a day or multiple sessions every week, so that we can get long-term adaptations in our brain to get benefits. Yeah.
Yeah, I see. So it becoming a pattern and a routine and something we do consistently is how we get those benefits. And you started then by talking about what's happening in terms of the chemicals in the brain and particularly dopamine. And I just wondered then, in terms of the effect of that, are there certain types of exercise that's more effective for managing ADHD symptoms than perhaps others are? What are the different effects between different types of exercise?
Yeah, so theoretically, there are two category of exercise. The first category is something more traditional, such as jogging, running, swimming. They are very aerobic based exercise. And as you can imagine, this exercise, the pattern is more constant, without significant changes while you are doing the exercise. And another category is we call multi-component exercise, or we call open skill exercise, such as football, tennis, or basketball. Because while doing this exercise, basically your environment is always changing, and you are not just exercise with yourself. Sometimes you have to exercise with a ball, a teammate, or an opponent from the other team. So theoretically, and especially for ADHD, this type of exercise, multi-component exercise, might be more beneficial for ADHD, because this exercise can create a so-called synergistic effects. So that means, in one hand, you get improved fitness by taking part in this exercise. Therefore, you get improved connection and attention. But in the other hand, this exercise themselves also train our attention, train our multitasking while we are doing the exercise. So for children with ADHD, I think so far the science support that multi-component exercise might be a bit stronger compared to something more aerobic focus, such as running or swimming. But not saying that aerobic exercise is not beneficial. They are still beneficial, because you can still get improvement in your fitness, and therefore you get improvement in your brain and connection. But just to say that multi-component exercise might be able to provide us something more comprehensive in terms of the impacts and the benefits. And I think it is very important for children with ADHD, because we know that children with ADHD or young people with ADHD, many of them also have worse motor skills, such as they have worse hand-eye coordination, they have worse balance, they have inferior, agility compared to their non-ADHD peers. So yeah, I would say that multi-component exercise might be more helpful or more powerful for ADHD.
That's so interesting, isn't it? Because I've always thought about the impacts of dopamine coming from the more aerobic sports, and I'll kind of come on to that in a minute. But actually, the multi-component element, as you were talking about, whether the fact you're connecting with a ball or the environment's changing or you're engaging with a team at the same time, and the impact that that's having on the brain. And I asked this purely for personal reasons. So would you say, I'm just thinking about my son here as an example. So his main sport is golf. That's his absolute love. But he does also swim and he does also play basketball. And I'm wondering whether in that sense, that combination of, I don't know if golf would be considered multi-component. I know you're not necessarily playing against somebody as such in the same way that you might be on a football pitch, but you've got the ball, you've got the constant changing environment, obviously you're outside in nature, and something like that, developing those motor skills combined with something like swimming from an aerobic perspective, would that be what you consider multi-component in that sense?
Yeah, this is a very good question. I think, say, as a rule of thumb, I think the most important thing is to diversify our exercise choices and our exercise options. So, yes, while I mentioned that multi-component exercise, such as football, might be more effective in some way, but I think at the end of the day, what is more important for children, especially kids with ADHD, is to find something that they have interest in and something that they are be able to keep engaging into the exercise. So yeah, I think the exercise your son is doing is actually pretty good. So he has swimming, right? So that is more aerobic focus. And he also attends to golf, which is attention and cognitively challenging. But for golf, I would say that the benefits might mostly coming from the cognitive aspect, because I will assume that you will only get minimal improvements in your fitness from golf or by playing golf. But I think the cognitive aspect or the cognitive benefit is there for sure. So yeah, it would be good to do different types or different modalities of exercise across the week, not just stick to one or single type of exercise.
Yeah, that combination and that variety, I guess, also sustains the interest and makes it something that can be long lasting as well. And you mentioned there the motor skills that are involved. So this is a completely anecdotal observation from the people in my support group and other parents that I know of children with ADHD, but there seems to be a tendency for children with ADHD to almost prefer solo sports, typically, not to say they're not playing football and other things, rather than necessarily team sports. So like my daughter, for example, she loves gymnastics, and you mentioned balance in particular, which is what made me think of it. So at the same time, would you say that those kind of sports have a positive cognitive and fitness effect? Would that be considered multi-component?
You mean like gymnastics?
Yes.
Yeah, I would agree so. We actually conducted a study a few years ago, not with children with ADHD, but with children without ADHD. So we deliver a gymnastic intervention for 8 weeks, and yes, we found improved fitness, especially their muscular fitness, and we also found improved motor skills, balance, agility after the intervention. And of course, improved connection. So yeah, I would say that gymnastic is something multi-component. Yeah,
that feeds into that. And then how about the length and intensity? Because you talked at the beginning about the effects of dopamine, for example, and the sustained impact of that, say, a couple of hours after exercising. Does the type of sport that you're engaging in, whether that's something that's multi-component, as you said, or that's something more aerobic, how does that impact in terms of the dopamine levels and the impacts on our brain for sustained duration, I guess, if that's the right way of asking it?
Yeah, I think when it comes to dopamine, I think the modality is not a key factor. I think for dopamine or any other, say, neurochemicals in the brain, I think intensity and duration are more important. So basically, if you want to get increased levels of dopamine or say serotonin after the exercise bout or session, as I said, the intensity must be at a moderate intensity, or even moderate to vigorous intensity. And in terms of the duration, I think based on research, we know that the duration per every session needs to be at the minimum of 20 to 30 minutes. Because, we have to reach a specific dose so that we can get increased levels of dopamine and other neurochemicals right after the exercise. If we fail to do that, we won't be able to get a very significant increase in these neurochemicals.
Okay, so we've effectively really got to get our heart rates up, and we've got to
Yes,
work.
you have to. You
to
have
have
to.
the impact.
Yeah, you have to.
Tell us a little bit about your research and what that shows about the impact of exercise on ADHD in children, because your research comes at it from a slightly different approach from exercise perspective, doesn't it?
Yeah, exactly. So previously, we used a neuroimaging tool called EEG. So EEG is a neuroimaging device to capture electrical activities from our scalp. So we use EEG to study what happened in the brain during or after exercise, especially in children with ADHD. So in our research program, we mostly looking at how a single session of exercise, such as exercise on the treadmill for 20 minutes and at a moderate intensity, we want to see how a single session of exercise can change brain function in children with ADHD. And what we found was actually very interesting. What we found was that after just a single bout of 20 minutes of exercise on the treadmill, children with ADHD, they can better detect and process distractors from the environment. And these benefits can sustain for about 1 hour after they stop the exercise. This is interesting and I think informative for children with ADHD, because just a single bout of 20 minutes of exercise, you can get the benefits. So if you can imagine that if we can repeat these single sessions of exercise throughout the day, throughout the week, the benefit is huge. And right now, we are also looking at something more cross-sectional. So we compare children with higher and lower weekly exercise levels and see what happened in their performance in terms of attention, impulsivity control. And what we found, again, was that children who engage in exercise more on a weekly basis, they also demonstrated better performance during tasks, such as tasks that focus on their attention, tasks that challenge their impulsivity control. And this is a data from more than 300 children with ADHD. Yeah. So based on these findings altogether, right now we are thinking to doing something more innovative, because we know that many children with ADHD, they also find traditional exercise a bit challenging and a bit difficult to engage. And there are many reasons behind this. It might be more difficult for them to get along well with their peers. And as I mentioned, children with ADHD, many of them, they also have worse motor skills, which make them difficult to effectively participate in traditional exercise, such as football, such as basketball, right? So right now we're thinking something more enjoyable or more gamified. So we are looking at a specific type of exercise called ActiGamer, which is something rather new right now. So ActiGamer is basically it's a combination of exercise with video games, and that means we deliver the exercise movements with video game and game console. So right now we're trying to conduct a series of study looking at the effects of ActiGamer on children with ADHD. Yeah.
That's very interesting, because I was thinking that as I'm talking, it's very easy for me to sit here with two quite sporty and active kids about the benefits of exercise on ADHD. But for many children, they can't access sport in the same way. And as you say, with this issues with peers, actually, I think when my son was younger, he would really struggle in a team context, because that was almost one thing too many for his brain to be able to focus on simultaneously. And also I was thinking about children with coexisting conditions who then might prefer to be at home, and I know parents can sometimes struggle to get their children out. So how could exergaming or other non-traditional exercise address those kind of barriers to regular exercise for children with ADHD? Because if we know that there's massive benefits, how do we bridge the gap for those that traditional exercise just feels impossible for?
Yeah, I think this is a very important question to consider. So I think based on our interview with some of our parents or participants, I think there are three core challenges for children with ADHD to take part in traditional exercise. The first one is, as we discussed, as we chatted before, their motor skills. They have problems in their motor skills. They have problems to get along well with their peers. And also, I think another factor, or we can say challenge, is that children or young people with ADHD, they also have lower motivation to do many things. In other words, and they're always seeking something new, something fun, and they're always seeking rewards. They cannot wait for new stuff or something rewarding. So I think all these factors together making traditional exercise a bit more difficult in a way. Yeah, so I think exergaming will be an advantage to address these problems because basically by doing exergaming, children can still experience the benefits of exercise, but in a more gamified, more enjoyable way. As you mentioned, doing exergaming, they will be able to get more flexibility. They can do this at homes. They can do this with their own pace. They can do this with their parents, with their siblings or friends. So I think this advantage are sometimes not be able to achieve by traditional exercise, because in most of the time we do traditional exercise in, say, during a sports club, during PE lessons, in schools. And yeah, so I think sometimes this will make engagement and motivation a bit challenging for children with ADHD. So I would say that exergaming could be something beneficial, or it can be complementary exercise options for traditional exercise. So not saying that we should completely replace traditional exercise with exergaming. I think it really depends on the preference and interest of the child, and depending on the condition and interest of the child. So for example, you can say, okay, today I feel good, my kids feel good and want to go outdoors, then we do traditional exercise today. The next day, they prefer doing something at homes with their families, then we do exergaming at homes. By doing either way, they get the benefits from exercise. So yeah, I think exergaming would be a way out especially for children with ADHD who also finding traditional exercise a bit difficult to access.
Yeah. I was just thinking that it's very complementary in that sense, isn't it? And also the other thing that came to mind is it's quite low demand. If you can be at home, and you can still do a form of exercise through exergaming, still get those benefits on your brain, it becomes something that's very much in line with the needs of a child. And then you're, I guess, going to, as a result, be able to engage them, have that natural motivation for them to want to do it. And to go back to your point right at the beginning, then this stuff might become more of a pattern and routine, and we might see it happening more frequently. And just for those listening to help them imagine exergaming itself. In my head, I've almost got visions of playing the Wii, about 20 years ago when you'd be indoor playing tennis or something. Yeah. Is that effectively what exergaming is? Tell me just a little bit about how a child would do exergaming at home.
Yeah. So basically, when you do exergaming, you have to interact with the game, with the controller, and with the game will obviously the game will be delivered by a game console. But basically, you interact with the game by performing these different exercise movements with a controller. The exercise movements during these games are actually very similar to what we typically do during traditional exercise, such as we have dancing, we have boxing, we have running, jogging, jumping around, high knees, and we have sometimes the games will ask you to do squat. So yeah, all these movements are very similar to traditional exercise, but you do it in a different way at homes. Yeah, basically.
Yeah, the comfort of your home. Actually, when you were saying that as well, the other thing that came into my head was during lockdown, the PE with Joe Wicks. Suddenly we were all at home, and short of going for your walk or your run a day, if that was your thing, we were suddenly at home with our children doing everything in one environment. And then that became such a significant part of people's day, didn't it? To get them moving, to get them exercising, and to doing something together. So what has the results of your exergaming work shown you so far about the benefits?
Yeah. So basically, as a first step, so right now we are trying to develop an intervention prototype, and we will be testing this prototype early next year. But before we have a prototype, we want to see how children and parents specifically thinking about exergaming, and are they happy with these video games? Can they accept these video games as a potential intervention? So between May and July this year, we invited about 24 families, children with ADHD and their parents, and we invite them to Kingston, to our lab, and they basically play 13 different exercise video games from Nintendo Switch. So they play these games, and they rated their preference, their liking of these games. And after these games, they had a short interview with us, so we can know their thoughts and feedback about these games. And we can also know what are the motivators or barriers for them to keep playing these games if they were given the opportunities. And also, when they play these games, we also had the child wearing a heart rate tracker, because we want to ensure that these games can indeed induce moderate intensity exercise. And as a result, I think the result came out very promising, to be honest. So basically, more than 80% of the games can actually indeed induce a moderate intensity of exercise, which is encouraging. And also from the interview, we also know that more than 80% of the child and the parents like the idea of using exergaming as a way to improve their attention, improve their fitness, and most of them share with us that they will be happy to keep playing these games at least a few sessions every week if they were given the opportunities. And I think what's more important from our data was that more than 90% of the parents share with us that they feel the games are easy to access, easy to implement in their households, and they support that maybe exergaming could be considered as a treatment strategies or lifestyle recommendation for ADHD. I think this is the most encouraging finding, because in the past, before we did this study, we thought that parents might be more defensive about playing these exergamings with their children, or they might be more defensive with the idea of their children playing these games, because these are video games in a sense. But the results turns out very promising and very encouraging. So so that's why I think based on these results and findings, we are currently developed the intervention prototype, and we want to test the prototype next year. Yeah.
That's very promising, isn't it? Because I think, as a parent of 2 children with ADHD, you're juggling a lot all the time. Parenting, it's obviously hard work for anybody, but particularly when you've got children who are neurodivergent, and having something like that in the home environment that actually leans into the child's natural interest, because obviously lots of kids who have ADHD love gaming for obvious reasons. But when we can see a really positive impact of the gaming beyond just it being enjoyable, in terms of obviously their physical health, their ADHD health in terms of symptoms, and then obviously I would assume that in the longer term, their mental health, it becomes a really positive thing to want to implement, and also easier, I should say, for a parent. That's something that is a relatively simple thing that actually doesn't necessarily require complete supervision. It can be done at home. So in effect, it could be done at any time, again, in line with the child's needs, what's going on for them that day. And I love the idea of it becoming part of almost like a treatment plan, because my view on this stuff is always that it needs to be very holistic, and that what that means is going to be personal from one child, one family to the next. But if this could become a really valid non-clinical treatment strategy, there's so much power in that, especially I'm thinking with the medication shortages that exist at the moment. I understand it's actually a relatively small percentage of children at the moment that are taking ADHD medication. But for many, it's absolutely life-changing. And if you suddenly aren't able to access that, managing symptoms becomes even harder. So from your perspective, how does exergaming, thinking in the long term with this feedback that you're getting, become part of a treatment plan for children at a kind of non-clinical level?
I think that's a very good interesting question, and an issue to thinking about. So I think based on the medication shortage right now and the very long waiting time on the camps waiting list, I think exergaming could be an interim intervention, or you can say it is an interim treatment plan or strategy, especially for children who either still waiting for their first contact, still waiting for their referral, or they had their first contact but still waiting for their medications. And because I think especially for those who currently do not have access to medication or still waiting on the list, they are so desperate looking for something, and something that they're looking at something might be helpful in any way for their children. So exergaming would be a perfect fit for this, because as we chat so far, it delivers exercise, so you get the benefits from exercise, and this exercise can address symptoms in relation to ADHD, improve our attention, cognition, or at least relieve our stress. I think it would be a good addition for both the children and the parents, especially during the long waiting.
Yeah. I think your point about waiting lists is a really valid one, actually, because this is something you don't need a diagnosis to exercise, do you, right? If you know that your child is really struggling, and suddenly this is something you can bring into the home environment, and there's a natural interest and motivation from their perspective because it's gaming, then actually it might help parents feel like they're able to do something constructive to help their child in the interim, because many are waiting years, aren't they, for the support and help that they need. So in an ideal world, I know this is very early stages for you, but in an ideal world, how do you imagine that happening? Obviously, you're using Nintendo Switches in your lab in terms of the study themselves, but would you hope this was something that anybody could buy? You could walk into a shop, go online and order this for something that your child could then use at home on their games console.
Exactly. Of course, I think that would be the goal for us to work on. But as you said, we are still in the early stage. So and in order to effectively promote exergaming to all the families, I think firstly we need to verify these games are feasible at homes, And secondly, we need to verify that this game is something scalable and promotable to a larger scale to the public. So I think, despite that, we still have a long way to go.
Yeah.
But I think based on what we have preliminary, these are very promising. And so you mentioned about the waiting list, because some of our parents, they mentioned that they did not have access to medication. So instead, they attend to psychological therapies. And they mentioned that they shared with us that, yes, these therapies are effective indeed. But again, taking part in these therapies require certain levels of commitment from them. They have to go to the hospital. They have to go to the clinic, go to the psychiatrist once or twice a week. They have to drive from their home to the appointments. So I think in that sense, again, I think ActiGamer would be an advantage because, as you mentioned, the threshold for everyone to play these games is very, very low. You don't need to be a coach. You don't need to be a professional to play these games. And I think our goal indeed is to promote, I think we have a very strong expectation on this, but still many things to verify. So far.
It offers a lot of hope, doesn't it? As you say, those are very long-term goals, but it does offer hope that actually something that is relatively simple could be implemented at home for all children quite easily, quite inexpensively, and with massive effects. So what one piece of advice would you like to leave parents listening in relation to exercise to help them on this ADHD journey?
I would suggest everyone that you need to find an exercise that you and your child can enjoy, and start with something easier and something more manageable. And I think specifically for kids with ADHD, we have to pay attention to their individual preferences and individual needs. And we start from something easier, more manageable, and we progressively increase the complexity, duration, and the dose of exercise. Another thing I would like to mention is that it will be crucial to diversify the options of exercise. So not just stay with one exercise, but rather we can do different exercise throughout the week. And I would say that social support is especially important for children with ADHD, because this will create a sense of belonging, and this will actually create social incentives. It's also very important for a positive behavior change, especially for people with ADHD. So that would be my advice.
Thank you, Stone. There's so many benefits to be had, aren't there, just beyond the physical impact of the exercise itself. Obviously, the very positive effects at symptoms level, but as you say too, socially, it's huge, and variety can help keep us engaged in the longer term. So thank you so much for sharing your expertise with us today. I think it probably offers a lot of hope to people where they have children where exercise is just not something that they innately really enjoy doing, but actually it gives them opportunity to find ways to still gain the same benefits on their symptoms and their overall ADHD management. So thank you for joining us today.
Thank you, Claire. Thank you for having me.
If you'd like to learn more about Stone's research and find out about how your children can participate in his study, then please do check out our show notes below for more information. Or if you'd like to find out about how I can help support you and your children with personalised ADHD coaching, then please do head to allaboardadhd.com. You can also find me on Instagram at allaboardadhd. Most importantly, if you enjoyed this episode and found it helpful, please can you follow and review All Aboard to help other parents find this podcast and welcome them aboard our journey too. Thank you for listening to All Aboard ADHD.